When a patient comes in and they've got pulmonary embolism, they've got increased pulmonary vascular resistance. Okay. So this is a potentially right heart problem. So we may not treat these patients in the same way that we treat left heart problems. So they've got increased right ventricular afterload. All right. So remember, the right ventricle doesn't work very well with afterload. It can't push as well as the left ventricle can. It just goes in there, pushes away. The right ventricle can't. It kind of fails a little bit. So what happens next is you get right ventricular dilatation because it can't pump that blood out. And the right ventricle bulges. And in effect, what happens is it bulges into the left ventricle, so decreases the amount of filling that the left ventricle can get, and such the cardiac output decreases because the left ventricle can't fill as well as it used to. It also causes ischemia. And because it's so prone to ischemia, and it's so easy for it to become ischemic, the right ventricle fails a little earlier than you'd expect the left ventricle to. So right ventricular output decreases, left ventricular output decreases. So what do? We put more fluid in. What does the fluid do? It increases pulmonary vascular resistance. The spiral continues. So we've got to think a little bit differently about how we treat pulmonary embolism and how we treat right ventricular infarction. So in right ventricular infarction,